In life, Michael Gibson was a registrar, recording the births, deaths and marriages of others. When he passed away in early April, his own cause of death was documented as probable COVID-19. His daughter Cathy says the implication of government policies which saw untested COVID patients sent into care homes must now be examined.
I think the government guidance that hospitals implemented to discharge people as rapidly as possible to care homes full of vulnerable people was incredibly irresponsible. I think it was an unbelievable act and they need to be held to account for that.
Who do you hold responsible for this policy?
It's got HM government on the top of it. Whoever wrote it originally, whoever edited it and whoever signed it off for publication must be held responsible for the consequences.
Michael Gibson was a resident at the Sherwood House Care Centre in Oxfordshire, a place which Cathy says looked after her father with great kindness. This is what we've pieced together about the circumstances surrounding his death. Cathy says staff told her a COVID patient was discharged back to the home in mid-March. I understand the home felt pressured to take the resident back and was told the patient hadn't had a temperature for 48 hours. Sherwood House say they weren't given any guarantees the patient wasn't still infectious. Sherwood House says taking back the COVID resident is one of several possibilities which could have caused the death of Michael Gibson. Cathy Gardner has a PhD in the airborne spread of infection. She says the lack of testing means she'll never know for sure how her father died, compounding the fact she couldn't sit with him in his final hours.
We did drive up and were able to go and see him through the window that night, on the Thursday night, which was just appallingly sad. It's not what I wanted to do at that time. But he died the next night, and it's very difficult to talk about that still.
The Equality and Human Rights Commission has said it's deeply concerned by potential breaches in the human rights of the elderly during the pandemic and is urging the government to acknowledge that.
The reality is that if that doesn't happen, we'll have to look very carefully at how we exercise our legal powers to ensure that government and local authorities are actually meeting their obligations.
We've raised Cathy Gardner's concerns with the Department of Health and Social Care and await a response. The government's strategy has been to protect the NHS from being overwhelmed and save lives, but at what cost to Britain's elderly in care homes? Lisa Holland, Sky News.